A Fox News doctor, part of the medical aid team, just ironically made the case for single payer healthcare.
Vice President Biden, if he wins, will definitely bring back the individual mandate and create a public option. And here we go again with big insurance and big government of a watered down type that doesn't pay for the kind of things we need. Now, right now, we're in the middle of a pandemic, and we have never seen such a public-private partnership as has occurred under the Trump administration. We're talking about Operation Warp Speed, making vaccines at a rate that's never been done in human history. We came together and we got all the supplies we needed eventually. The testing has ramped up. All of this occurred backed by private insurance, the current healthcare system. Watered down overreach wouldn't work. And by the way, Ainsley, did you hear the word insurance at all during this pandemic? You know why you didn't? Because people that were uninsured were covered for COVID because of the coronavirus relief packages. Health and Human Services went out and made sure people got the care they need. That's how healthcare works, with doctors, nurses, and the government backing them if in an emergency, not with expanded, watered-down insurance.
He's all over the place. Look, you guys know that's Dr. Mark Siegel, right? Again, Fox News' medical aid team. And he was defending the administration by pointing out that thanks to the government, HHS, people without private insurance, say that they were able to get care for coronavirus because, hey, we already paid for it because we passed legislation to make the government cover them. But and says that's how healthcare works, right? Well, I mean, that's kind of how a single payer system would work. And ironically, he's using that language against a public option, which, by the way, we don't even know that Joe Biden is actually going to do that. There's a recent report out where there are people in the healthcare industry, the health insurance industry, that are already putting out negative ads and talking points about, because they successfully crushed single payer, against a public option now. And that Biden and the Democrats, if they win, are not even going to focus on doing that. They're going to first focus on introducing the ACA fixes. So anyway, back to this member of the medical aid team. No, that's not how healthcare works, right? Look, you shouldn't have to hope that whatever afflicts you reaches global crisis level and then have to wait for Congress to pass a relief bill so that the government can help you with that, right? I mean, it's almost as if a universal healthcare system that cut out private insurance death panels would be better. And you're kind of accidentally making that point. I mean, with that out of the way, let's get some facts, right? So now, private insurance, at least employer-sponsored, about 5 to 6 million have lost their employer-sponsored insurance, which means they don't have it anymore. They just don't have insurance. You think that people who are unemployed can afford COBRA? No, they can't. That's one of the problems with our health insurance system. And actually, it's far worse than even we're saying. For example, the nonpartisan Kaiser Family Foundation is actually estimating that anywhere near to 27 million Americans have lost coverage in the pandemic. So now, why the disparity in those numbers, 5 to 6 million? It's because they count families. You know, you can go to work, and if your employer, offers insurance and you can actually afford to get on it, well, you won't just get on it yourself, right? No, normally you will cover your wife and your kids. And that's one of the benefits of employer-sponsored insurance, because you actually get a better deal than if you were to go out in the private market. And so you can't just be like, oh, no, I just lost my insurance. No, the entire family just lost their insurance. So, yes, they count. So, yeah, those are more accurate numbers. And so the 5 to 6 million vastly is a vast undercount of the real scope of the problem of having private insurance that is tied to your job, right? And so not only that, but those millions of people would be helped by a single payer healthcare system. Now, another analysis published by the Urban Institute and the Robert Wood Johnson Foundation projected by the end of 2020, 10.1 million will lose their employer-sponsored health insurance or coverage that was tied to a job. And again, I think that's an undercount because you've got to count the family members in there. So you could conceivably look at possibly 50 to 60 million people without, that have lost their health insurance through whatever family member had health insurance through their job. And so this is a disaster, right? I mean, if anything shows how healthcare does actually work in this country, it's these disastrous numbers. But the entire premise of Mr. Siegel is wrong, right? Of what he said. People in this country haven't just been helped by this, right? By the packages that went through Congress. The administration has claimed, oh no, we're actually taking care of everybody with coronavirus. No, you're not. No, people are actually getting charged and paying thousands of dollars in medical bills related to coronavirus. In fact, a man and his 3-year-old daughter faced more than $3,900 in bills for care for coronavirus. Others have been charged over $2,000 for tests. And there was one pretty well-known account of a woman having to pay or getting a bill for over $400,000 for coronavirus treatment. And another study has pointed out how the cost of a coronavirus test can vary by 2,700% in the same emergency room. That is a wild variation. I mean, that it's insane to run a healthcare system like this. And yet this guy's making the argument that no, everything works great, even though I just pointed out how government supporting the doctors and nurses through an emergency, in his view, is excellent. I mean, this is how it works. Oh, and by the way, even if you have insurance, right? Some doctors, and even though, you're not supposed to be charged for coronavirus, some doctors have decided to send their own bills to patients directly anyway. I mean, it's how it works when you don't have a single payer healthcare system. And even if your bills are actually technically covered, you still have to fight with your insurance company, fill out government forms, whereas, of course, single payer means everything is covered with none of the bullshit. No forms, no fighting with insurance companies. You know why? Because everything is covered, and that's it. It is amazing how people in power can continue to defend this ridiculous system when the answer is obvious. It's right in front of our face. Medicare for all. Every other developed country in the world has a system of government-sponsored health insurance for everyone. Yes, there are varying levels of coverage. And yes, in some countries, there are also private insurance options. In some cases, there are nonprofit insurance companies, and that's where they get, most of their healthcare. Nonetheless, no country works like America because everyone has looked at America's system and has decided that it's not going to work. And it's also barbaric. We live in a barbaric system that lets people die so that health insurance companies and corporate CEOs can make a goddamn profit. It is an immoral system. It's wrong. It's expensive. And yet, if you're out there defending it, you're a terrible person. That's it. Everything about this pandemic has laid bare the problems with our for-profit private health insurance system. And yet, there are people in power that ignore it. They ignore it. And you know why they ignore it? It's because, A, they get bribed from the health insurance industry and at the same time have the best government health care our money can buy, because that's where they get it from. They get it from us. Okay, we pay for that through our taxes and they get government health care. Okay, think about that. Think about that. The next time that you get sick, the next time that you get a gigantic medical bill, or the next time you realize that you can't go and see a doctor because you can't afford the copay, you can't afford the deductible, okay? Think about that, and then think about what you're going to do about it.